Welcome to PS Military and Veterans Health Division webinar on TRICARE Prescription Coverage. If you have questions, please type them in the webinar chat and save your questions until the end if possible. Your question may be answered through the course of the webinar. Would you want to listen to this presentation again or have others you know who may want more information on this topic? It will be put on the TRICAREforYou.com website portal no later tomorrow. Literacy program provides the prescription drugs you need when you need them in a safe, easy, and affordable way. These prescriptions are managed through the pharmacy contractor Express Scripts. Prescription drug coverage is available to active duty and retired service members and families, National Guard and Reserve members and families, retired National Guard and Reserve service members 60 and older and receiving retired pay and families, widows, widowers, and certain former spouses, recipients and families, using the following plans: the TRICARE Select, the TRICARE Retired Reserve, TRICARE Young Adult, and the Kentucky Health Care Benefit Program, or CHCBP, and the other beneficiaries, including foreign force members and families. If you're eligible and you turn 65 on or after April 1st, 2001, must have Medicare Part B to be eligible for TRICARE prescription coverage. If you enroll in Medicare Part B, you may get your prescriptions filled only at military pharmacies. D is Medicare's prescription drug plan. Medicare D is available to anyone who is eligible for Medicare Part A and Part B, or Part B, sorry. TRICARE is creditable prescription drug coverage. This means that you won't pay extra if you decide to enroll in a Medicare prescription drug plan after initial enrollment period. To become eligible for Medicare Part D, you will receive a letter in the mail explaining how your TRICARE prescription drug plan works with Medicare Part D. You want this letter for your records. You may need it to show you don't have to pay extra if you decide to enroll in Medicare Part D. You do need to enroll on a Medicare Part D prescription drug plan to keep your TRICARE prescription benefits. For most beneficiaries, there is no advantage to enrolling in a Medicare drug plan. When whether or not to enroll in a Medicare prescription drug plan, you should compare it to your TRICARE prescription drug plan and be sure to look at the monthly premiums, deductibles, copays, and coverage. If you decide to enroll in a Medicare prescription drug plan, you will pay second to Medicare during your initial enrollment period or an open enrollment period. The open enrollment period runs from November 15th to December 31st. Your prescription drug coverage will then begin the following January 1st. For pharmacy options, they are military pharmacies, home delivery, network pharmacies, and non-network pharmacies. Each is available worldwide with some limitations overseas. Under TRICARE's prescription plan, you can fill your prescriptions for free at military pharmacies. Military pharmacies stock drugs on the basic core formulary, as well as many brand name maintenance drugs on the uniform formulary. Call your pharmacy to verify if your prescription is available. You get a 90-day supply for most drugs. There are ways to fill new prescriptions depending on where you are getting them filled. If you're in your prescriptions at a military hospital or clinic, you should send it electronically to the pharmacy or can send it in at the pharmacy for it to be filled, or drop it off and pick it up later. If you're a civilian provider who is TRICARE authorized, call a pharmacy to see if your prescription can be filled. If ask your provider to e-prescribe or take the prescription to the military pharmacy. You order it to be filled or drop it off and pick it up later. The military pharmacy can't fill your prescription. The staff can work with your provider to find an alternative, or fill it through home delivery or at a network pharmacy. Select maintenance drugs must be refilled through home delivery or at a military pharmacy. Even if you fill the prescription at a network pharmacy, you may switch to home delivery. Each pharmacy may have a different refill process. Check your pharmacy for details. If you're a user on the TOL patient portal, you may be able to order your refills online. You'll also be able to transfer prescriptions from a network pharmacy to a military pharmacy. Call Choice Center at 877-882-3335 for more information. Military pharmacies, the TRICARE Pharmacy's home delivery is the least expensive way to fill prescriptions. For most, you can get up to a 90-day prescription at the following costs. Drugs, no cost. Brand drugs, $20. Non-formulary drugs, $9 unless you establish medical necessity. TRICARE home delivery will ship to any address in the U.S. or U.S. territories, including APO and FPO addresses. All other overseas areas, you must use your APO-FPO address. You can't use private foreign addresses. You can use APO-FPO addresses for refrigerated drugs, and home delivery is not available in Germany. Do note that home delivery to APO-FPO addresses is subject to the local customs laws. Drugs sent to APO-FPO addresses may be seized by customs authorities. If drugs are seized, contact Express Scripts at 877-363-1303 or local toll-free number and other ways to get your prescription drugs filled. All beneficiaries, except active duty military, must get refills for select brand name maintenance drugs through home delivery or at a military pharmacy. If you choose to fill your select maintenance drugs at a network pharmacy, you'll get a letter from Express Scripts telling you that you need to switch. A second time, you'll get a letter from Express Scripts about switching. The third time, you'll be responsible to pay 100% of the cost. No rule does not apply if you live outside of the U.S. or U.S. territories. There are some limitations on TRICARE Pharmacy home delivery. Do you have health insurance with a pharmacy benefit? If so, you can use home delivery if your plan isn't covered by your other plan or you reach the dollar limit on your other plan. Express does not accept home delivery refill requests in Germany. Been filled right away? Are you able to get to a military pharmacy? If so, you can visit a TRICARE retail network pharmacy. There are more than 58,000 locations in the U.S. and U.S. territories, including Guam, Puerto Rico, West Virgin Islands, and the Northern Mariana Islands. There are currently no network pharmacies in American Samoa. Visit expressscripts.com/TRICARE or and then select Find Pharmacy under Tools. Also locate network pharmacies by using the ExpressRx mobile app or call Express Scripts at 877-363-1303. Note that pharmacies aren't located in other overseas areas. In the Philippines, you must get your prescriptions filled at a certified pharmacy. Filling prescriptions at a network pharmacy is easy. Ask your provider to send your prescription electronically, or you can carry your written prescription to the pharmacy. You show your Uniform Services ID card. If you have problems at a network pharmacy, please contact Express Scripts. You may not be able to fill your prescriptions at a retail network pharmacy. Some formulary drugs are only covered through home delivery or at military pharmacies. All beneficiaries except active duty service members must get refills for select maintenance drugs in the U.S. and U.S. territories through home delivery or at a military pharmacy. This applies to most brand name drugs. You can refill most generic maintenance drugs at a network pharmacy. You can do a 30-day supply of most prescription drugs at the following costs. Generic for $10, brand $24, and formulary for $50 unless you get medical necessity. Formulary drugs are only covered through home delivery. Check with Express Scripts before filling prescriptions for non-formulary drugs at a retail network pharmacy. If a 90-day supply of your prescription, you'll pay the cost for each 30-day supply. For example, a supply of a generic drug will cost $30. The TRICARE formulary for more information. You can get covered vaccines for no cost at participating network pharmacies. To find a pharmacy that offers vaccines, you can search online, call 877-363-1303. At non-pharmacies, you'll have to pay full price for your prescription drugs and file a claim for reimbursement. Rates are subject to deductible or out-of-network cost shares and copayments. Deductibles must be met before we can reimburse you. If U.S. and U.S. territories, you should visit a non-network pharmacy only if you have no other options. Overseas pharmacies, in U.S. territories, are network pharmacies, but sometimes an overseas pharmacy may be your only option. If you use an out-of-network pharmacy, you will have to pay full price first and file a claim for reimbursement. Do you overseas? Try most prescriptions at military or overseas retail pharmacies. Home delivery may be available with limits. Network pharmacies are available only in the U.S. and U.S. territories. The drugs aren't covered overseas. In overseas, we recommend you fill prescriptions before your trip. If you're out of your prescription drug, you may use a military or overseas retail pharmacy for refills. You can get your prescriptions filled for free at military pharmacies. Military pharmacies are usually at a military hospital or clinic. Some military bases have freestanding pharmacies located elsewhere on the base. If prescription from an overseas provider, you can fill it at a military pharmacy, but there are some limitations. The prescription must be from an authorized, licensed healthcare provider. Military pharmacies stock drugs on the basic core formulary. You can leave up to a 90-day supply for most drugs, and we recommend you call first to check if your prescription can be filled. Overseas retail pharmacies may be your only option. You for the total amount first and then file a claim for reimbursement. Service members will get a full reimbursement. Active duty family will get a full reimbursement when enrolled in TRICARE Prime Overseas or TRICARE Prime Remote Overseas. All others will get a partial reimbursement based on non-network pharmacy costs. Remember, filling a prescription in the Philippines, you must get your prescriptions filled at a certified pharmacy. To use delivery in overseas areas, you must get a prescription from a U.S. licensed provider. You must use your APO/FPO address. If you don't have an APO/FPO address, you can use a pharmacy you can use the embassy if you're assigned to one. You can use private foreign addresses. Use APO/FPO addresses for refrigerated drugs, and home delivery is not available in Germany. Home delivery APO/FPO addresses is subject to local custom laws, of course. Prescription drugs sent to APO/FPO addresses may be seized by customs authorities. Prescription drugs are seized. contact Express Scripts at 877-363-1303 or look at your local toll-free number to find other ways to get your prescription filled. These TRICARE Network pharmacies are in the following U.S. territories: Guam, Puerto Rico, and U.S. Virgin Islands. Living or traveling in other overseas nations, you must use military pharmacies or overseas retail pharmacies. We recommend that you get your prescriptions filled before you travel, but need one filled while traveling, you can. Fill prescription at a military pharmacy if one is nearby. Find the closest network pharmacy available in the U.S. and U.S. territories, or if a pharmacy isn't available, visit a non-network pharmacy. Home isn't recommended for a prescription you need right away. If you're taking a long vacation, you can arrange for any regular prescription to be filled via home delivery. For more information about prescription drug coverage, you can contact Express Scripts by calling toll-free number 877-363-1303, writing us on screen, Express Scripts Incorporated, Box 52150, Phoenix, Arizona 85072, visiting their website at express-scripts.com/TRICARE. You can get additional information about prescription drug coverage on our website, www.tricareforyou.com. If you have some questions for us today, go ahead and type them into the chat now. This is WPS Military and Veterans Health Division TRICARE webinar on prescription coverage. Just remember that a recording of this webinar will be available for viewing on our website, tricareforyou.com, tomorrow. Thank you for the time with us today, and have a great day.